What are painkillers? Are there hidden dangers in their usage? This video is for educational purposes only. Painkillers, or analgesics, are medications designed to alleviate pain without causing loss of consciousness. They are used to manage various types of pain, ranging from mild headaches to severe post-surgical discomfort. Painkillers can be classified based on their mechanism of action and the type of pain they treat. Here are the primary categories. 1. Non-opioid analgesics. These are commonly used for mild to moderate pain and have anti-inflammatory properties. Paracetamol, also known as acetaminophen, is often used for headaches, fever, and minor aches and pains. Non-steroidal anti-inflammatory drugs, or NSAIDs, include ibuprofen, aspirin, and naproxen. These reduce inflammation and are used for conditions like arthritis, menstrual cramps, and muscle aches. Opioid analgesics are used for moderate to severe pain, especially when non-opioid analgesics are ineffective. Morphine is commonly used in severe pain management, including cancer pain. Codeine is used for less severe pain and is often combined with paracetamol or NSAIDs. Strong opioids like fentanyl, oxycodone, and hydrocodone are used for severe chronic pain or post-operative pain. Adjuvant analgesics are not primarily painkillers but can be used to treat specific pain types. Antidepressants such as amitriptyline and duloxetine are used for chronic pain and neuropathic pain. Anticonvulsants like gabapentin and pregabalin are effective for nerve pain. Topical analgesics are applied directly to the skin to relieve localized pain. Capsaicin cream is used for neuropathic pain and arthritis. Lidocaine patches are for localized pain relief. Mechanism of action. Non-opioid analgesics block the production of prostaglandins, substances that mediate inflammation and pain. Opioid analgesics bind to opioid receptors in the brain and spinal cord, altering the perception of pain. Adjuvant analgesics modulate nerve activity to reduce pain perception. Usage considerations. Short-term use is ideal for acute pain such as injury or surgery. Long-term use is for chronic pain management requiring careful monitoring to avoid dependence, especially with opioids. Side effects. Non-opioids may cause gastrointestinal issues, while opioids can lead to sedation, nausea, and potential for addiction. Safety and monitoring. Prescription guidelines. Painkillers, especially opioids, should be used under medical supervision to manage dosage and monitor for side effects. Over-the-counter options. Many non-opioid painkillers are available without a prescription, but should still be used according to guidelines to avoid overuse or interactions with other medications. Emerging alternatives. Non-pharmacological therapies. Physical therapy, acupuncture, and cognitive behavioral therapy are increasingly used as alternatives or adjuncts to traditional painkillers. Common painkiller medications category paracetamol examples Tylenol, Panadol. Common uses fever, mild pain category NSAIDs examples Advil, Aleve. Common uses inflammation, arthritis category opioids examples OxyContin, Vicodin. Common uses severe pain, post-surgery category antidepressants examples Elavil, Cymbalta. Common uses neuropathic pain, chronic pain category anticonvulsants examples Neurontin, Lyrica. Common uses nerve pain category topicals examples Icy Hot, Salampas. Common uses localized pain, muscle pain. Understanding the type of pain and its severity helps in choosing the appropriate painkiller. Always consult a healthcare professional for pain management tailored to individual needs. Dangers of painkillers. Painkillers, while essential for managing pain, pose several risks and potential dangers, particularly when used improperly or over long periods. Understanding these risks is crucial for safe use. Here's a detailed look at the dangers associated with different types of painkillers. 1. Non-opioid analgesics, paracetamol, also known as acetaminophen, liver damage. Overdosing can lead to acute liver failure. It is crucial to stay within the recommended dosage. Over-the-counter combinations. Many cold and flu remedies contain paracetamol, increasing the risk of unintentional overdose if used concurrently. Non-steroidal anti-inflammatory drugs, or NSAIDs. Gastrointestinal issues. Long-term use can cause stomach ulcers, bleeding, and gastritis. Cardiovascular risks. Increased risk of heart attack and stroke, particularly with prolonged use. Kidney damage can impair kidney function, especially in individuals with existing kidney issues or the elderly. 2. Opioid analgesics. Addiction and dependence. Physical dependence. Prolonged use leads to tolerance, meaning needing more to achieve the same effect, and withdrawal symptoms if stopped. Addiction. A serious risk where the user develops a compulsive need for the drug, often leading to misuse and illegal acquisition. Overdose. Respiratory depression. High doses can suppress breathing, which can be fatal. Overdose risk. Particularly high when combined with alcohol or other depressants or when used recreationally. Side effects. Sedation and drowsiness can impair ability to perform tasks like driving. Constipation, common with opioids, often requiring additional medications to manage. Nausea and vomiting, frequently experienced, reducing quality of life. Adjuvant analgesics, often used to enhance pain relief, come with their own set of risks. Antidepressants, for instance, can lead to various side effects such as weight gain, sexual dysfunction, and sleep disturbances. There's also the risk of serotonin syndrome, a rare but potentially life-threatening condition, especially when these drugs are used alongside other serotonergic medications. Then there are anticonvulsants. These can cause drowsiness and dizziness, which might really affect daily functioning. Additionally, it's important to note that some anticonvulsants carry a warning about an increased risk of suicidal thoughts and behaviors. So, while adjuvant analgesics can be beneficial, it's crucial to be aware of these potential dangers. Topical analgesics, yeah, they can be quite effective, but they come with their own set of risks. Some users may experience skin reactions such as rashes or irritation, and although it's rare, some topicals can be absorbed in amounts that cause systemic side effects. When it comes to painkillers, there are general dangers that span across different types. One major concern is the interaction with other medications. Painkillers can interact with other drugs, leading to increased risk of side effects or reduced efficacy. And let's not forget alcohol. Combining painkillers with alcohol can amplify side effects and increase the risk of organ damage. Misuse and abuse are also significant issues. Recreational use, particularly with opioids, can lead to addiction, overdose, and even death. There's also the problem of doctor shopping, where individuals seek multiple prescriptions from different doctors to obtain more medication. Painkillers can also impact mental health. Long-term use, especially of opioids, can contribute to depression and anxiety. Prolonged use can also affect cognitive functions such as memory and concentration. Reducing the risks associated with painkillers involves proper use and monitoring. It's crucial to always use painkillers as prescribed by a healthcare provider and have regular check-ins to assess the necessity and dosage. Alternatives and adjunct therapies can also play a role. Non-pharmacological therapies like physical therapy, acupuncture, and lifestyle changes can reduce reliance on painkillers. Combination therapy using lower doses of multiple medications can help minimize side effects. Let's wrap things up with a quick summary. Understanding the main dangers associated with different categories of painkillers is essential. For paracetamol, the main dangers include liver damage and unintentional overdose. NSAIDs come with risks such as gastrointestinal issues, cardiovascular risks, and kidney damage. Opioids, well, they pose dangers like addiction, overdose, respiratory depression, and various side effects. Antidepressants can cause weight gain, sexual dysfunction, and serotonin syndrome. Anticonvulsants carry risks like drowsiness, dizziness, and even suicide risk. Topicals can lead to skin reactions and systemic absorption risks. And generally, drug interactions, mental health impacts, and misuse are concerns across all types. The safe use of painkillers involves understanding these risks, adhering to prescribed guidelines, and exploring alternative pain management options when possible. Always consult with healthcare professionals to determine the best approach to pain management tailored to individual needs. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more health tips and updates. Thanks for watching.